Welcome, everyone. I'm Dr. Sasha Hamdani. I'm a board certified psychiatrist. I'm an author and an entrepreneur behind the Psych Doctor MD. I'm so excited to see so many other creators that I admire here at what I hope will be the first of many creative briefings hosted by the Harvard School of Public Health Center for Health Communication and YouTube. I attended a series of similar Harvard briefings earlier this year, and as a creator myself, it was incredibly helpful to get a chance to connect with experts in the latest mental health research and policy. And I'm so excited that with YouTube's help, they're offering these briefings to more creators. So just quick bonus, registering gets you access to the Center of Health Communications content toolkits, which are made by Harvard just for creators. And it makes you eligible for future in-person opportunities, which I will tell you, having spent 2 days at Harvard this summer, learning from my fellow creators and Harvard's faculty you're going to want to apply for that. It was awesome. So today, I'm thrilled to be joined by one of those Harvard faculty members I got to know in August, Joe Allen. Joe is an associate professor at the Harvard T.H. Chan School of Public Health. He's also a world-renowned expert on the connection between air quality and our health. So, for example, he directs Harvard's Healthy Buildings program. He wrote a book called Healthy Buildings: How Indoor Spaces Can Make You Sick or Keep You Well. He keynoted the White House's first ever indoor air quality summit, and he advises big name companies and other organizations on how to design buildings that keep people healthy. He's authored over 100 peer-reviewed scientific papers and regularly contributes to the New York Times, Washington Post, Harvard Business Review, and The Atlantic. One of the most surprising things I learned from Joe this summer is just how much the air we breathe affects our mental health, which is, right, that's shocking information for a psychiatrist and for anybody. The connection between air pollution and mental health really is a critical aspect of mental well-being. But it's just been overlooked this entire time. And that's becoming less and less okay as wildfires and pollution threaten the air we breathe. With World Mental Health Day coming up in just a few days, it's an incredibly timely topic and one that we creators can help people more and better understand. Not just the science, but how to take action for healthy air for healthy minds. So I'm going to hand it over to Joe to tell you a little bit more.
All right, thanks, Sasha. Yeah, this is really fun for me to speak to all these creators out there. And I was at that event in August, and it was really interesting and helpful for me too, to kind of think about our own messaging and then also how to connect with real experts and getting the message out on this critical topic of how air pollution influences our mental health, which I totally agree with you, Sasha, is overlooked, has been, well, I think understood in the scientific community, but I don't think we've always done a great job of getting our message out. I think we're scientists. I think our communications are science is good for the most part, and that's okay, but we need your help to get this message out. I can talk about some of the science here around outdoor air quality and then my specialty of indoor air quality, and I'm going to, I think, surprise a lot of people, make a connection here, but maybe just I'll level set before I get into some of the specifics. When we're talking about, what are we talking about when we talk about air pollution, right? And I think most people know air pollution is bad for us, and maybe you've even seen these stats that air pollution kills, several million people per year around the world. And most of that's through cardiovascular disease. It causes lung disease and influences our lung function. But I think fewer people recognize the connection between outdoor air pollution and things like anxiety, depression, dementia, overall cognitive function. And it's been a little bit of a miss in terms of our raising awareness of how the environment can influence our mental health, not just cardiovascular health, not just our lung health. Yeah.
I think it's so important that we're even broaching this topic for the first time, because I know as a psychiatrist, it's not something that was on my radar, even prior. And then when you spoke in August, I was so compelled by not only the statistics, but just like within my own personal experience, I was like, oh yeah, that it's been mind-boggling to think about that as a variable. I'm excited to hear more.
Yeah,
I won't interrupt.
I'll throw some stats out there because I think for those who are thinking, well, hit me with the science on what we need to know. And so I put together some notes and I went through the literature and started to think about, okay, how do we summarize this? And in terms of things like anxiety and depression, there's a couple different scales that air pollution is impacting us on. So in the immediate, has an immediate effect. So there are some big studies of tens of thousands of people that show that even the last 2 days of exposure to outdoor air pollution is associated with an increase of hospitalization for mental disorders. But it's not just the short term. There's studies in the US that several months of your exposure also leads to increases in anxiety symptoms, depression symptoms. One study found a 60% increase in anxiety symptoms associated with higher levels of outdoor air pollution. That's a big number, and that should be really surprising. There's also studies showing what long-term exposure does. And there I'm talking about on the order of years. We're chronically exposed to outdoor air pollution, not just during these wildfire events or when the sky gets hazy and everybody can see it, but just general background air pollution showing that you see a decreased quality of life, increase in depressiveness, increase in diagnosis of depression, and increase in suicide ideation, all associated with largely one indicator of outdoor air pollution called PM 2.5. which is one of the main components of outdoor air pollution. I can tell you all about it if you're interested and why that really matters and how it influences our mental health. But I wanted to lay that out as kind of set the scale of what we're talking about. There are these acute effects. Whatever happens today is influencing you today. Whatever happened today is going to influence you several months down the road. Whatever happens over your course of your lifetime is also influencing your mental health. And that's just anxiety and depression outside of all the other effects we know of.
I think that all of this is really interesting in terms of, yes, definitely you should talk more about those values, but I think all of this is interesting because when I heard in August about the depression and anxiety part of it, it didn't even cross my mind as a possibility. So tell everybody more. I'm so excited.
Yeah. So I gave a couple scales of the anxiety, depression, all the way through suicide ideation. Yeah. We can look at other dimensions of this. So take some research by my colleagues at the Harvard School of Public Health, looking at the association between air pollution and dementia, right? So there's now all sorts of studies showing that, again, higher exposure to outdoor air pollution, when outdoor pollution is bad, people have a greater exposure to these particles and other toxic chemicals in the air. And we see increased rates of dementia, Alzheimer's disease, Parkinson's disease. We see a really stunning study showing a link between higher levels of breathing in outdoor air pollution during the third trimester of pregnancy and an increased risk of autism. So you start to build these stories. Oh, we know no outdoor air pollution causes premature mortality, lung disease, influences anxiety, depression, dementia, Alzheimer's risk, Parkinson's disease risk, maybe associated with autism spectrum disorder. And it starts to build a damning picture of what we're breathing every day and just how much of an impact it has on our brain function. And it's, to your point earlier, I think we know this in our field. It's well known in our field at this point, but I don't think that message has fully got out there that of all the things that matter to mental health, and there are many, of course, I think one of our goals is just make sure that when we enter the environment into this conversation, to say the environment, and specifically the air we're breathing, has a big impact on all of these dimensions of mental health.
When did we start noticing this? Like when did people start putting these pieces together? Is this like a new revelation? Is this a new field kind of thing? Or have people always suspected this?
Well, I think we can go back to like outdoor air pollution as one of the best studied environmental hazards we know about, going to the really famous Harvard 6 City studies conducted maybe 30 or 40 years ago, which really put air pollution on the map. But that was around premature mortality. But it did set the basis for what's called the National Ambient Air Quality Standards. So there are limits to how much we're allowing in the air, or what we think is a safe level, largely around these studies of premature mortality. And really interesting, when we've put these national ambient air quality standards in place, what happened? The air pollution dropped, and we saw a reduction in premature mortality. All great, massive public health wins. I'd say over the past 10 or even 15 years, and even some of this newer research is starting to open our eyes into what else matters as we start to look at these studies of, say, a famous study looking at kids in particular and emergency department visits for mental health. And this was done at Cincinnati Children's Hospital, some great children's hospital, looking at over 10,000 visits. And what did they find? A link between kids going to the emergency department for mental health treatment associated with higher levels of breathing in bad outdoor air pollution. So I think some of this literature, particularly around Alzheimer's, Parkinson's, that's relatively new. And I think there's still a lot of scientific inquiry here, but it all makes sense in terms of the building, science builds, right? One study tells a story, we start. And if you look across all these studies, and by the way, these studies I mentioned are from all over the world. This isn't just a US phenomenon, a China phenomenon, a European phenomenon. No. These are studies conducted all over the world because we're talking about basic human physiology and the impact. So the story is unfortunately really robust at this point.
I think for a long time, you think about outdoor air pollution and you think about air quality and you think about respiratory stuff. You think about like, this is going to impact the lungs. You think about potentially impacting the heart. But this truly in August was, after hearing you speak, that was the first time I connected it to the mental health part of it. I'll let you continue, but I have questions about outdoor pollution, how we got from the outdoor pollution and then kind of moved into this indoor air quality.
Yeah, so let me bring it to a space I really like to bring things to and turn this into a story about the air we breathe indoors, right? So we're talking about outdoor air pollution, but the reality is, this is going to shock a lot of people. The majority of exposure to outdoor air pollution occurs indoors. So say that again. Most of the outdoor air pollution you breathe indoors. You think, well, how is that possible? Outdoor air pollution comes inside of our homes, our offices, our schools, and not just from open windows and open doors. They find ways into the building in all sorts of little cracks and crevices, and yes, open doors and windows and things like this. So yes, the exposure, the amount is reduced as it comes inside for the most part, but we spend 90% of our time indoors. So even if the levels are lower inside, you're breathing 9 out of 10 breaths inside. And so your total dose of the amount you breathe in for the day of outdoor air pollution happens inside. On top of everything else that happens inside, we have all sorts of indoor sources of air pollution. We have chemicals we use to clean. We have cooking generates particles. We have allergens from pets and things like this. And you have all that outdoor air pollution that comes inside. So I saw your pet there. So that's a key part of the story that actually I think is missing even more than the air pollution and mental health, is that when we're talking about air pollution, it's also an indoor air pollution story. It's not just something that happens outside when the skies turn orange. It's an all-day, everyday threat that also, I want to keep this positive too, we could talk about this, is manageable. There are things we can actually do. We need to do some structural things, societal things, but also the things we can do as individuals to kind of help protect ourselves from outdoor air pollution and indoor air pollution.
Okay, so what are those? I'm stressed.
All right, so that's right. So it can't be a stressful conversation. It's my brother always says, if you're just offering up problems without solutions, that's just called complaining. So we don't want to be complaining here. We're going to find some solutions. I think there's a couple things to do indoors that really make a big difference. And I guess we have to break it out. Are we talking about like somebody's home? Are we talking about big schools or commercial buildings? But I'll refer to a report I wrote with the Lancet COVID-19 Commission. So the Lancet's a big medical journal. I was the chair of one of their task force on safe work and safe school. And we wrote a report called The First 4 Healthy Building Strategies Every Building Should Pursue. And the first is kind of really simple, is to give your building a tune-up like you do for your car. And think about it, right? If you don't give your car a tune-up every year, if you own a car, it doesn't perform as well, right? You got to get the oil change, make sure the wiper fluids, right? Align the tires, basic things. we don't always do this for buildings.
Mm-hmm.
And when we don't do that, the performance drops, right? In terms of air quality, the filters aren't in right, the fans are broken, something's off in the system. So the very first step is what we call commission your building, or I think of it as giving it a tune-up. Second, we want to make sure we have enough ventilation or amount of clean outdoor air coming in. Sometimes we choke off the air supply in our buildings. We don't let our buildings breathe. And there's a buildup of indoor air pollution. So we do need to ventilate our buildings. Mm-hmm. But number three, we need to increase the level of filtration such that the air you're bringing in is clean. That should make total sense. I think it makes sense to everybody.
Yeah.
But historically, the way we've designed buildings and put in filters, we've used these very low-grade filters. They're like boulder catchers, meaning like they're designed to protect the equipment, capture like gross big stuff, but not a lot of that outdoor air pollution. Well, there's cheap, effective, higher grade filters called a MERV 13 filter. It's great for protecting us against COVID and influenza, and also from outdoor air pollution, wildfire smoke. So bring us up to speed. We have give your building a tune-up, make sure you're ventilating correctly, upgrade your filters to MERV 13. And fourth, if you can't do anything else, you can supplement with these portable air cleaners. You know, these HEPA filters you've probably seen in the store and things like this. Plug and play device, turn it on, you size it right for the room. It's actually going to capture a lot of these particles. So I would start there. There's more we can do. We can talk about the home and cooking and what else to do in cleaning, but I like those as kind of basic strategies to say, hey, we can actually bring in air, we can filter it correctly, and we can even use these kind of plug and play, relatively inexpensive devices to clean the air if the air pollution's bad.
So you were talking about like how what we have in place right now is trying to protect the equipment and not the people inside the building. Is that simply because it was cheap, or because of like why was that allowed to happen?
So that's a great question, right? What if it's so obvious, like why? Honestly, one of the reasons I wrote a book, like I can't figure it out. I mean, I know why historically it's happened. And really back in the 70s, in response to the energy crisis, we started to tighten up our buildings, right? And everything was about saving energy, saving energy. Well, that's great and important. But at the same time, we ushered in what's known as the sick building era. Low ventilation, poor filtration. Sure, they were more energy efficient buildings, but at the expense of people's health. And actually, if you think about COVID, so you had a respiratory virus, spreads nearly entirely indoors in under-ventilated, under-filtered spaces, and it bumped up against our building stock, designed to these bare minimum standards. And so it's no wonder we had the disaster that we had. And one of the things we're trying to do with this conversation on healthy buildings is get us out of that sick building era and say, like, you were kind of incredulous. How we design buildings when we know it's ineffective or the bad thing to do, and kind of move us into, leveraging this good science and say, we actually know how to do better when it comes to outdoor air pollution. We know how to do better when it comes to indoor air pollution. Yes, we should be using filters that protect people, not just equipment. And by the way, this doesn't cost all that much either. So you should be kind of shocked, like, wait, why are we doing better with the way we design and operate our buildings? It's been a point of frustration for me for my entire career, because I used to do forensic investigations of sick buildings. I've seen all sorts of things go wrong in buildings, cancer clusters, disease clusters. And every time it was like these super simple fixes, really. A little better filters. There's some toxic chemicals used that shouldn't be used, some poor construction, and like really straightforward things to keep people healthier indoors. We know how to do this. We can keep people safe indoors. And we just have to change that mindset. It has to shift to like a public health mindset on how to create these spaces that are good for people, where they can thrive, good cardiovascular health, and also lead to better mental health. And so the indoor environment, it's a discussion about air quality and mental health, but the indoor environment, it has this really big impact. I mean, we spend all of our time indoors, so it makes sense. We're talking about air pollution, but I'm glad this has shifted to a conversation about indoor air in particular.
I would agree with you. And like, so this might be a silly question, like from a logistical perspective, say you are working in a building that is old and disgusting and you had questions about you're renting a space out in this office building. And so is this something that you go to your landlord or whoever's maintaining the building? They're like, what is the filtration thing you use? Like, how do you start that conversation?
Yeah. So I think the first thing to do and the best thing you can do is start the conversation. And I think you'll learn a lot, right? If you ask your landlord, hey, I heard, someone talk about these MERV 13 filters. Do we have those? And if you get a blank look,
Yeah.
you kind of have your answer, right? And now no one really paid attention to filters, but during COVID, everybody kind of has. And so you can ask about these things. What are we doing in terms of the materials we choose for our space? And what are we doing in terms of the air cleaning in the building? What are we doing in terms of ventilation? The other thing I think it's a really good chance to bring in is that there are now low-cost tools that can help you measure what's happening. I have a couple here right now that I have in my office. I'll show you one. So I'm measuring air quality in my office. You can measure this in your home or school, or wherever you want, your favorite coffee shop. So two numbers here I'm showing. One is PM 2.5. Oops, it's going to link up in a second. That's outdoor air pollution. Or PM 2.5 is one of the main components of outdoor air pollution. It's 4. That's good. Right now, the limit for outdoors is about 12. So we want to see, I want to see under 8, really. So that's pretty good. Second number here is carbon dioxide. That tells you how well it's ventilated. And I like to see a number under 800 parts per million. I see here under 800. So right now, the air quality in my office, I can feel pretty good about. And objectively. And that's cool because it used to be like, you'd have to hire someone like me. I'd have like a $10,000 piece of scientific, an instrument to go out, take a measurement. These things are now a couple $100. You can go out and measure yourself. You can bring it around and you can figure out quickly, measure, hey, what's the level of air pollution in here? And is it good or bad? Or you can bring that to your landlord and say, hey, I measured this. I know what the limits are. How come we're over the limit? What's going on?
And you can do it in real time also. Like if there's like heightened air pollution outside and then you see a huge shift in those numbers, you can reasonably assume that something is going on with that filtration and ventilation process.
Yeah, that's right. I'll give you a great example. So when we had the wildfire issue blanketing the East Coast of the US, right?
Yeah.
We saw unreal levels of outdoor air pollution, things I never thought I'd see on the East Coast. Several hundred microgram per cubic meter, 500, 600, 700. Well, we have upgraded filters at the Harvard School of Public Health. We put them in response to COVID. We also have these monitors. So we could look at the monitors in real time, to your point, and show people that even though outdoor air pollution was really bad, because we had good filters, the air quality indoors was still safe. So as a way to kind of, to your point, diagnose the building, hey, is there something not working right here? Or reassure, not in a hand-wavy fashion, but in an objective way that says, oh, good, we feel okay about how our buildings are performing right now, even when things are bad outside. Mm-hmm. So we have these deployed. We have air quality sensors all over the School of Public Health. When you were there, they were all in the classrooms we were in. We have them at Harvard Business School. We have them in the Harvard Health Clinics. I think you'll start to see more of this kind of lower cost, real-time air quality sensor coming into play.
So I love that. So the best thing you can do, like, especially if it's not your personal space, like if it's where you work or things, is like start that conversation, get those, like figure out, engage the response of like who maintains the building. Like, are you taking care of your building? How do you measure and monitor your air quality?
Yeah, that's right. And now that there are these, target numbers out there, I can give you a couple more. You can actually go in and say, hey, how come the carbon dioxide's 1,000 parts per million? I heard it should be, CDC says it should be 800. What's going on here? Or the national limit for PM 2.5 is 12. How come my office or school is 20 or 24? That's not right.
What's the name of that thing?
So I don't like to promote brands, and I have a couple behind me. So for, I'm not,
but like if you were to search for it, where is it something you can get on Amazon? Like where do you get these?
Sure. So you can look around, or you can message me and I'll tell you the ones I use and we like in our research studies, or I can tell you the ones that I use at Harvard. You can get them anywhere, Amazon or anywhere else, and just put in air quality sensor. And you want to look for ones, a lot of them have, like this one is just carbon dioxide, but some of them have, carbon dioxide and particles. I like the one that have particles too, because the particles are the outdoor air pollution. And it tells you, like, outdoor, my levels are at 5 right now. Outside's about 12. I know my house is doing a pretty good job. So I like having the particles on the monitor as well. But yeah, you can get them. They should be anywhere from $100 to $300.
Okay. Okay.
Yeah.
Well, I think that's an incredible place to start. And then in terms of the home stuff, like that's like work and landlord, but home is, especially after COVID, as so many of us have gone remote. And that's probably yeah, I mean, I know I spend a tremendous amount of time at home. Besides those portable plug and play things, is there anything that we should know? Like, should we be mindful over how do we get our house to look like your house?
Well, to be fair, if I keep going in here, you'll see my CO2 level come up. Like I'm trying, like everybody else, trying to make this old house kind of perform a little better. And sometimes it means cracking the window. And I use portable air cleaners when things are not that great. I think there's a couple things to do at home that are that can really help, right? That are relatively low cost. I mean, I think the portable plug and play air cleaners are really can be quite effective, particularly if you have someone who has asthma or has allergic reactions. You can capture some of these particles out of the air, or in a place with bad outdoor air pollution. If you're near a highway, I think that's really important. I think other things are also simple, like recognizing that when you're cooking, you're generating a lot of these particles. And actually, if you're making like a stir fry on the stove, you can have particle levels that look like a bad outdoor air pollution day. Like starts to hit, remember the limit was about 12, you could start at 100, 150. And so some of the things to do, if you're cooking, crack open the window a little bit. If you have an exhaust fan over the stove, absolutely use it. Those exhaust fans should be exhausted outside. Many just recirculate. In other words, they'll capture and then just kind of spew it back out, which is a design flaw, but it's kind of how we've designed a lot of buildings. I think you could, as we start to think about upgrading, or if you're in the position to swap out gas stoves for electric. Gas stoves can release gases that are associated with outdoor air pollution, but also indoor air pollution, like nitrogen dioxide, which is associated with, amongst other things, it's a respiratory hazard, but is also associated with mental health, particularly for kids. So these are all kind of related, and we're bringing it back to mental health. It's all kind of related, but to think about what happens in the home, it's not just what penetrates from outside, but things like managing cooking, using fewer scented cleaners that can off-gas what we call VOCs, or volatile organic compounds. So there's a couple strategies I think that are just I'd call them simple, or can be simple, but we don't always think about them.
Let me move back because I got a great question from Dr. Tracy Marks. Circling back to the environment of like an office environment. She said, these are great tips for people who have control over their building environment. Anything to suggest for the ordinary person who can't control the air quality of the buildings they visit?
Yeah, I mean, I think this is part of the structural change that we need. So outside of these things, like what does an individual do? I am encouraged that for the first time, we're starting to get away from these minimum standards for how we design and operate buildings. So I worked with the White House and the CDC and a group called ASHRAE that sets standards for buildings. And there was a massive shift just this spring that most people probably didn't pay attention to, but it's the first time both organizations put out a health-based target, right? And what that's going to do is eventually it's going to change practice such that, look, none of us should have to worry about the place you're going into, whether it has good, clean air. Right? You drink water out of the tap, you expect it to be clean. When you go indoors to a school, an office, a coffee shop, you should have the same expectation. The air is clean. But the standards have lagged behind the science. I see that shift changing, and I also see an awareness changing. New York Times has ran a 3-part series this summer, like the New York Times talking about indoor air quality. That's a big deal. The White House talking about indoor air quality. There's 4 bills in New York City right now going to mandate real-time indoor air quality monitoring in schools and government buildings. Same thing's happening in Massachusetts. So it's a really good question about, what can we do that's in our control? The things that aren't in our control, I really think have to come with these kind of big structural changes. And I think for the first time, at least in my career, we're starting to see movement there. The standard setting bodies are changing. CDC is recognizing this. The White House is recognizing this. New York Times is recognizing that this is an issue. And there are new bills in cities kind of breaking the veil here. And like, once you have monitoring and you can see the data, it's pretty hard to hide from that. Boston Public Schools have air quality monitors in all their classrooms. You can't hide from that anymore, right? And they're sharing it with parents and teachers. So if you have the data, you can't hide from any problem you find. So I think that, I think it's an awareness thing. I think it's a structural thing that is going to have to change before this becomes a non-issue. And hopefully I'm put out of business, but I think that takes several years still, unfortunately.
Yeah, but I mean, the sheer fact that we have that the shift is starting to happen, right? I mean, I think that you're absolutely right. The fact that this is getting more national attention and that we are seeing not only like we're starting to catch up with the science, and that's so exciting to see. I do have another question. This is from Kalita Himes, who was another creator on the Harvard panel with me. It's fantastic. In Title I schools, are there more issues with poor indoor air quality? And does it relate to low test scores and productivity?
Yeah, so good question. We're talking about kind of mental health and air quality, and then we can extend this to cognitive function and all the way out to test scores and disparities and environmental justice. So let's weave all that together. So if you look at many studies, again, across countries and across any age group, you see a very strong link between indoor air quality and test performance of kids in schools. And that's reading comprehension tests, that's basic arithmetic tests, that's higher order cognitive function tests. So the air we're breathing, how much ventilation, filtration, same things we're talking about right now, or have been talking about, are associated with performance. And what do we see in terms of the impacts and across these other factors that are going to have a big impact? Well, we know, for example, that schools are underventilated and have low levels of filtration to start with, baseline across the country. Then in schools with populations that are predominantly Black or Hispanic, and or populations that predominantly have students on free or reduced lunch, so low income, we see even worse performance in terms of ventilation and filtration. And then that's like things that are hidden for most people. On top of that, you see the things that are in the news. Look about Detroit schools and lead in drinking water. Lead in drinking water has been a problem in Boston public schools. And so we see these disparities across race, ethnicity, and income. And then, we see it also then in the data when it comes to air quality and mental health. I mentioned earlier this study in the US showing a 60% increase in anxiety symptoms related to outdoor air pollution. Well, we saw even greater impact, worse impact, for people who are low income. So across all of these studies, you see this disparity, and you see the disparity in terms of the way our buildings are designed and operated too. And so that's where these kind of, again, these structural solutions have to take place, right? We have to just make it the norm that the way we're designing and operating buildings is good from a code standpoint, such that it's not a who has the resources to do this, right? It shouldn't be a privilege to breathe good indoor air. Right. It should just be the norm. And it's not. And we see gross disparities.
The thing that's shocking is that earlier in this conversation, you were like, it's not expensive to implement these changes. And you would think that in the long term, if you're maintaining your building appropriately and you're putting in these like safety and regulation kind of things, the building's going to last longer, that it's going to behave better over time and serve us better.
Well, you're right. And so some of these things actually cost like a couple dollars a month. Like a better filter is a couple dollars more. I'm not kidding. This is not like millions of dollars. A couple dollars more. In my book, I wrote my book with a Harvard Business School professor, John McCumber, and I did that on purpose. He's an expert in real estate finance. And to your point, there's also just a good business case for doing this. Right? So we walk through the economics here and we say, look, if you have good air quality in your building, people are absent less, they perform better on cognitive function tests, they're more productive, students score better on all of these tests. So it's a no-brainer But then we walk through the economics and we show from a business standpoint that the benefits are on the order of $6,000 to $7,000 per person per year from a productivity standpoint, at a cost of $10 to $40 per person per year. So just I'm a public health professor. My goal is to improve people's health. But you want to make a business argument outside of that? Yep, it still works. This is just good business. We also show that businesses can see gains up to 10% to the bottom line when they improve indoor air quality. Other researchers have shown that when you make healthy building investments, that these buildings command higher rents or premiums. So investors should be paying attention to this. And then society-wise, Lawrence Berkeley National Lab has shown that there's $20 billion benefit to the US economy if we improve indoor air quality. So we can take this any level we want, make a straight business case, it's there. Make a mental health case, it's there. Make a more premature mortality case, it's there. General well-being case, it's there. These are absolute no-brainers, and the costs are actually cheap. It just hasn't been a priority for us. And I'll tell you, if I keep going, I'll tell you why I think it hasn't been a priority. So yeah. If we started this conversation and just said, ask people what constitutes healthy living, right? We're going to get the same answers. Got to exercise. Yeah, that's good. Got to eat well. That's good. Have a good social network. Yeah, all these things we know. Don't smoke. Outdoor air pollution is bad. No one is going to say indoor air quality. Nobody.
Yeah.
And we breathe, 90% of our breaths happen indoors. It's just been this glaring hole in our understanding of what constitutes healthy living, just how important. Even these conversations about outdoor air pollution and mental health, most of the time fail to recognize that what happens outdoors influences indoor. Take Mayor Adams in New York City during the wildfire event in New York City, kept telling people, go inside. That's great, but it's incomplete. You have to go inside to a place that has good filtration. Otherwise, you're just breathing that outdoor air pollution indoors. And so even in public messaging from our leaders, we're missing this connection of how important the indoor environment is to our health. And that's all aspects of health, right? Cognitive function, mental health, cardiovascular health.
Well, piggybacking off of this, because our comments are going berserk, so from Meg Haywood-Sullivan, have there been any long-term studies on mental health and increased air pollution attributed to climate change events, specifically wildfires? Curious about the impact here in California.
Well, yeah, I mean, we see the impacts of, wildfire smoke are transient events, but I have to say that wasn't so transient, certainly this summer and not across the Pacific Northwest. It was constant this summer. I think it's something we're going to see a lot more of. And I think what that relates to, so we see the impact of chronic exposure to PM 2.5. And what happens with wildfire smoke is you get not just these pervasive, we call them lower level, like it's happening right now in Boston where I am and everywhere else, but you get kind of these surges, these really high levels that are acutely dangerous. And by the way, we see that when these levels rise like that, you see an immediate impact in terms of emergency department visits. You see impacts on mental health visits to hospitals. So we see these kind of immediate impacts, and we're going to see a lot more of that due to the changing climate. There's no question. We're seeing and experiencing that right now. So I think that's a good question. But something interesting too that I don't think caught as much attention as it possibly could, but colleagues of ours at the School of Public Health also showed a relationship between wildfire smoke and COVID risk. So you're breathing in these outdoor air particles, actually influencing the ability of your immune system to defend against other hazards. So people who are breathing higher levels of wildfire smoke, outdoor air pollution that penetrates indoors, also had higher risk of respiratory disease from COVID. And so we tend to think of these in silos. Oh, outdoor air pollution. I'm an indoor air pollution researcher. Someone's a COVID researcher. Someone's a mental health researcher. Someone's a lung doctor. But actually, it's all related. It's all related. Yep. And we see these impacts when we study them. We see these negative synergies.
So coming right off of that, there's a question from Rachel, one of the other creators that was invited to this summit. Is there a way for an individual to assess if their mental health symptoms are associated with air pollution versus a different life stressor or circumstance?
I think it's really hard on an individual basis. I think it's a really good question. I think it's really hard to kind of tease these out. It takes these, honestly, it takes these big studies where we can say we followed 10,000 people, and on average, we see these impacts. We see the impacts of social injustice, environmental justice, higher level exposure. In all these studies, we control for these other factors: race, ethnicity, eating habits, age.
Yeah.
So I think as an individual, we're just trying to reduce. The same thing would be nutrition studies. Like, what exactly is it? We kind of know what healthy eating is, but if something goes wrong in our body, we don't always know what the exact cause was. So what we try to do is just lead healthier lifestyles. So yeah, we try to eat better, try to exercise, everything in moderation, including moderation, and then we want to also try to keep indoor air as healthy as we can, as healthy as we can.
But I think also a big portion of it is just acknowledging that that's a variable, right? Because when you look at mental health as such a multifactorial and multifaceted, and right, it's just like a nebulous kind of thing in general. Utilizing that as one of the things that you think about, talk about. I mean, it's when I met with you in August and first kind of had this on my radar. Since that time, Joe, you should know this because this is true. It's something that now I discuss in my initial psychiatric evaluations as part of like that diagnostic criteria, because I think it's important enough to start discussing and opening up that dialogue so that people start thinking about it.
Sasha, just got goosebumps. I tell you, that means a lot, because I think about all this work and research that's done by colleagues and people, scientists all over, but like, we're not getting the message out through creators like you and influencing practice, and we're not really doing our job. So, and I'm also really grateful to Harvard's community comms folks for making these connections, because this is the exact kind of information we need to get out, and you're all the people to do it. And ultimately hope it leads to change in practice. I think you nailed it, right? There's so many, this is multifactorial. This is your field of expertise. And all I want to do is make sure we inject the environmental factor into the conversation, and hopefully give people some tools and resources for how to manage that aspect as much as they can, while we try to work on these kind of policy level changes.
Then let me give you one more question, even though there's so many more, and I'm so sorry we can't get to all of them. So I'm going to merge together two questions. Laura Young asked a question, Trevor Wright asked a question, and I'm just going to kind of morph them into one. So what is your advice for communicating about this? How would you suggest we start this conversation with others who don't realize the significance and that the impacts that air quality can have on health?
All right, so that's a really good question, and you're all the experts in how to best communicate all this. So, but I'll tell you what I do. I think it usually, I think it grabs people. So
Yeah.
when I'm talking about my field, I talk about that 90%. Because I think once you say we spend 90% of our time indoors, I turn it into your indoor age. So if you live to your 80, 72 years of your life spent indoors. As soon as you say that, I think it reframes everything like, wow, of course, the indoor environment has a massive impact on my health. I think that helps get people's attention. Like, okay, this is a topic I might want to pay attention to. And then it opens doors into everything else. We want to talk about air pollution and mental health. Yeah, let's start outside like we did today, and then bring it inside, and then say, this is actually what's happening. It kind of makes sense. Well, I'm breathing all this air. Yeah, it's having this effect. Yes, it can influence my brain function, my heart function. Yeah. How do I get rid of that? Well, I got to use better filters to trap it. Okay, that makes sense. I want to measure it. Okay, that makes sense. So I that's where I kind of start with it as the first way to kind of grab people's attention that this really matters, and it's been ignored. For the indoor environment, and the impact on our health has been ignored.
Wildly ignored. This is just as great as it was in August, but unfortunately that's all the time we have with you, Joe, and we appreciate this so much. And Harvard Center for Health Communication and YouTube, who came together to make this creator briefing possible. So thanks again for joining us. We hope that you left inspired for World Mental Health Day. Watch your inbox for a copy of the companion toolkit Joe and the Center of Health Communication put together for you, complete with the links to the evidence and calls to action that Joe talked about. And for more information about future opportunities for creators from Harvard and YouTube, look out for that. See you next time.